In addition, we've used other methods, so we're using a patient questionnaire and also patient experience trackers, which are those things that you sort of press in sort of motorway service stations when you're happy or not happy. So we're using those electronic methods of data collection as well. So what do the patients want? Well, we're about halfway through the focus groups. So we don't have the thematic analysis yet, but for the purpose of today, I just wanted to share with you some of the early themes that are emerging. They want more information on treatment. They want more information as early as possible on what the treatment would look like. They want more convenient services. And coming back to the point that was made earlier, they have very strong views on some of the types of intervention, and taking blood was one of the key ones. And a very, very strong preference came out for dry blood spot testing over wet bloods for all of the reasons I suspect that we heard about earlier. So the next step, as we collect and do the thematic analysis, is to think, how is that going to affect our services? How are we actually going to define and deliver our services in a way that listens to and takes into account the views of patients? Accessibility and convenience, we're going to look at opening times, satellite clinics, how we provide information. We need to look at how our staff are trained, a theme that's come through all of this morning. And we're going to try and ensure quality by developing what's called a BBV bundle, a package of care. Why will the project work? Well, we think this project is going to work because we've got patients to identify the barriers and the solutions, and we're combining that with a robust evidence base. We're going to be drawing on the experience of local clinics who are performing well, and the mantra of the project is to change systems, not people. We hope to reconfigure working practice rather than need extra staff and resources. And by doing it that way, we hope we'll make a realistic model for the NHS, and something that, if successful, we can mainstream and disseminate. The project has a dissemination strategy through a range of outlets. I mean, the project doesn't now finish for another 18 months, but in around 18 months' time, please look out for the findings. They're going to be coming out through clinical networks, patient groups, Royal Colleges, conferences, etc. And we're also developing a sustainability work stream so that any improvements we make can be perpetuated. And the sort of things we're looking at are organisational culture, patient and staff ownership, and commissioning, early involvement of commissioners. And again, I don't know how many commissioners are here today, but it's very useful to have your opinions on this. Collaboration is key. This slide briefly flashed up earlier, but I'm glad it didn't get shown because I do think it's fantastic. In a sense, what you've got here, you've got substance misuse services and you've got hepatology services, both doing a fantastic job. Unfortunately, the patient's not doing very well. And what I hope is the Prevent project will enable us to do this, but joined up. Thank you very much.